Welcome to Beyond Four Walls. Each week, we sit down with leaders, creators, and change makers to uncover the moments, pivots, and lessons that shape their success in business and life. Welcome back to Beyond Four Walls. Today, we have an amazing guest. I'm so happy to have you. Daniel Shearer is the Chief Marketing Officer of Maple, a Canadian-born virtual care platform. Maple is a company with a vision of making healthcare accessible anytime, anywhere. And while Maple is changing how Canadians approach care, what's equally interesting is Daniel's marketing background and entrepreneurial mindset as he works to build the Maple brand as in this disruptive sector. Thank you for being here, Daniel.
Thanks for being here.
Yeah, thanks for having me, both. Great to meet you.
Great to meet you.
So just for our listeners, I think what's interesting is you went from being the president of Cassette, working with brands like Google, very involved in SickKids versus, so really being on the agency side, to now being in-house in a company that is scaling quickly, really revolutionizing the digital healthcare space. Can you share your story on how you made that shift, why you made it, and tell us a bit about that?
Yeah, happy to. And thanks again for having me on.
Yeah.
I think it's amazing, this platform that you're building to
Thanks.
celebrate innovation and entrepreneurship in Toronto and in Canada. So yeah, great to be here. Yeah, I mean, I was not just the president of Cassette. I grew up in agency land. So I would call myself an ad brat because it was actually in the family as well. And so I knew that I wanted to be sort of in agency land, as I would call it now, for the bulk of my life, really. And so I graduated university on a Friday, and when all my friends took their skis out west to
Where'd
go
you
skiing,
go for university?
I went to King's Étal.
Okay.
Yeah, and then I did a year in Montreal. But yeah, my degree is from King's Étal out in lovely Halifax.
Mm-hmm.
And so half my friends, put skis on their back and went out west, and the other half took backpacks to Europe or Thailand or whatever. And I, like a total nerd, started in an agency gig on the Monday. And
Wow.
so, yeah, I was right into it right away, and had the great fortune of growing up through some great companies, including Taxi and ultimately Cassette.
Mm-hmm.
But I also had sort of an itch that at some point I would want to go to, what we would call in the business, the sort of client side of it, and get that exposure. Because the truth is, when you're an agency president or an agency head, a lot of your time is actually counseling senior clients on what they should be doing, right? So I was spending most of my time with CMOs, CEOs, chief technology officers, chief HR officers, and thinking, helping them think about how do they want to think about their brand through the lens of various files. So I got a taste for what that could be like with, some of my great partners at, as you said, Google, McDonald's, SickKids, TD Bank, YouTube, Canopy Growth, and many others. And so I knew at some point I wanted to make that loop. And I just thought maybe the universe will show me the moment for that to happen. So when I left Cassette, I took some time. I have 2 young kids and a wonderful wife. And that was like a year and a half that was just an absolute gift. And then I was quite far down the road, actually, on a couple of agency opportunities when Maple came calling. And I came in actually at first just to consult, just to sort of, they'd gone through a recent change, settle the team a little bit, set a bit of a vision. And in fact, my mandate from the CEO, Brett Belchetz, who's a friend previous to this, was to hire the next CMO. And as I got in there and I got to understand the company better and the people and the mission and the need, we'll talk more about the need for, innovation in Canadian healthcare. I sort of, a couple of weeks in, looked at them and I went, I think I got to stick around. And lucky for me, they were happy for me to do so. So what started as a little bit of help for a friend ended up being, this next chapter of my career. And I feel so lucky to have sort of happened into it in that way.
Amazing. And Maple was founded in 2015, right?
Literally 10 years ago this year.
So you've come in at a stage when, I think the culture's probably pretty solidified. The branding's there. You weren't really a part of it in the early stages.
That's right.
I guess talk about the challenges coming in maybe at a later stage and what your kind of entrepreneurial mission is within this corporate culture.
And I'll try to do it without saying the super annoying word intrapreneur.
Yeah.
But you're right to point to being let's face it, kind of a corporate guy.
Yeah.
Coming into a very entrepreneurial environment. And so we're very lucky. Maybe I'll start with the beginnings of Maple because it sort of sets the groundwork for the whole thing. So 3 founders. So Brett, who I mentioned, currently CEO. his background was both consultancy. He was with McKinsey, but also he's a doctor. So he's one of those very annoying people who goes to biz school, becomes a consultant, crushes it in that, gets bored of that, then goes to med school. And then, we'll come to the genesis story that his medicine background led him to. But that's Brett.
Yeah.
Then we've got Stu Starr, who is our chief technology officer. So he was the sort of tech voice, the builder, the digital guy to make the vision happen.
Mm-hmm.
And then the amazing Roxana Zayman, who is our COO. And she's a little bit more like me. So she came actually from a banking background at TD. And she sort of makes, I always say that she makes sure that the trains run on time.
Mm-hmm.
Like she makes Maple happen. Mm-hmm. So very strong operator, great for culture, and also had over the years been a great sort of catch-all for a lot of the departments. So marketing at some point reported up to her. HR, what we would call people and culture, still reports up to her. So those are the three. And what's amazing is they're still super involved. They're in the office with all of us every single day. And I think, as committed as they've ever been. And at the same time, they've, I think over the years, recognized the need for a couple more voices around the executive table. So so you've got myself in as chief marketing officer, and you've got the amazing Mark Caltabiano, who's our chief product officer. And so in the digital world, your chief product officer and your chief technology officer would work very closely. So Mark and Stu are a team. And then we've got our head of business, new business development, who's Amy Stevenson. So there's a nice mix of the original three that had the vision built, really the first 10 years. And then some fresh energy. Mm-hmm. And I really, I've taken a lot of learning from Maple, even just in my first year. But one of the things that I've been so impressed and appreciative of is the degree to which those who founded the company have genuinely made space for new opinions. And you can imagine the pride that you would have and the ownership that you built this thing. It's literally their baby. And I would imagine it being quite difficult to welcome new voices in and not just sort of say, well, we've done that before, or I thought of that already. But they're really up for going on the journey with some fresh perspective at the table. So if it's been fun so far, I credit them for that because they've made the ride really enjoyable. The other thing is, when looking at companies at the sort of 10-year mark, it seems to be one of those numbers where if things are going well, it's a moment for reflection. And it very much has been a moment of reflection for Maple in that so much is going well. I mean, we're growing like crazy. We're the number one healthcare provider in Canada by visits by far and away. The culture is really strong. The amount of what I call mission buy-in is like nothing I've ever seen. Like every single Mapler knows why they're there, and it doesn't matter their role on the team. They're clear on what they're contributing, and that adds up to something bigger. So there's lots going well. And at the same time, I think there's such an opportunity for us to introduce ourselves to Canada in a bigger way. Because I know, we've had some conversation. Maple's been in your life in the past, out at a cocktail party or at a kids ski race or something. When people find out I'm from Maple, some people will come and say, oh my God, you saved my life at 3:00 in the morning, or you helped me go on that trip, or you got me that mental health help that I needed that I couldn't access anywhere else. And at the same time, not enough people stop me to talk about that. And I think, for such a loved and necessary and crucial service for Canada, I think everybody's recognizing that there's a bigger chance to really introduce ourselves to Canada in a bigger way, clarify our mission, really help people understand how virtual care works. And I think that's, at the highest level, my next opportunity is to bring that introductory energy to Maple, on this 10-year anniversary.
Yeah, I think from a customer perspective, and I've told you this before, like I can't say enough, we've got 3 children, how many trips to SickKids you guys saved me. Obviously, you've been involved with SickKids and I want to dive deeper into that. But middle of the night, like you just want an opinion on, do I need to get more critical care or am I okay to sit tight?
Or can I have a prescription and I'll into the 24-hour?
I'm stressed and I got a sty on my eye.
And I got a big meeting tomorrow.
Just help me.
No, absolutely. And even just relieving the stress, like a real life example. My children, I have young children, 4 and 1, in the same office as their pediatrician. There's 2 others. One of them's retiring, and he has not found a replacement to take care of thousands of children who are now left high and dry. And I can only imagine how those parents feel, because some of them, obviously, it's more than just a runny nose. There are serious problems that need to be dealt with.
Yeah, absolutely. No, we have 18 or 19 specialties, and there's tons of stuff that can be dealt with virtually, exactly to that point, around mental health therapy and sleep therapy and all sorts of pediatrics and dermatology. There's just such a broad range of stuff that, there's not going to be one single solution in Canada that solves the crisis that we're in. But we at Maple are so proud to be one of the big contributors.
Helps to alleviate it.
To alleviate the pressure. Because guess what? It's so interesting that, Nat, in your example there, you were going to SickKids. You weren't even thinking about going to a walk-in or to your family doc, because your family doc is doing their best, but they're probably only got a spot for you in 2 weeks. And the walk-ins are great as an emergency measure. The challenge with walk-ins is you often end up leaving with one more bug than you arrived with. So if Maple can be one of those 24/7 services that helps take some of that pressure off the system, we all win. And it's just stunning what these founders have built. I mean, most of the time, and I'd be interested in your take, most of the time you're getting an appointment within 10 minutes, less than 10 minutes. And that includes 3 o'clock in the morning. So we're one of the only 24/7 in the world. And I did it 10 days ago at 3 or 4 in the morning. And I got an appointment in 5 minutes.
So in order to facilitate that, how many doctors are on call and available?
Well, let's talk about the model first,
Sure.
because I think that's what's most important. And maybe this is where I'll get to the genesis story.
Okay.
So Brett Belchet's our CEO. He's at the time a working Emerge doc. And what he's finding is, first of all, he's seeing firsthand, the crisis that is, and this is 10 years ago, or really even 12 years ago now. And think about how much worse as a healthcare system we are now. But he's witnessing firsthand what's going on the ER floor. There just aren't enough people. There's too many people streaming through the door. And how can I get through my caseload? And meanwhile, when he's taking his tiny break on his 12-hour shift, all the time his phone's blowing up with, can you look at my kid's eye? And these are friends and family just saying, hey, should I go to the Emerge? What do you think? And he's starting to think there's got to be a better way to use this thing called your phone that we use for everything else in our life, like how we connect with loved ones, like how we get a job, like how we share photos with grandparents, like how we do our banking. Why isn't this thing playing a greater role in healthcare delivery? So he had the idea of Uber for doctors and patients. So how do you become a sort of a connector for patients that have a need with providers that have some spare time? And so that's the beginning part of it. So unlike some of our competition in the industry, we actually don't hire any doctors out of the system. Very proudly, 99.9% of our doctors maintain their practice in some way. The only small group that might not continue their practice is those who are retiring. But even those who retire then can still come and give 3-4 hours a day, 3-4 hours a week on Maple. So we actually don't take any capacity out of the system. We enhance capacity from the existing doctor pool. So that's a really critical thing to know. So how they've figured out the algorithm over the years for matching supply and demand, there's a great art and science to it. I mentioned Roxana earlier. Without Roxana, this would not work. But we have thousands of doctors at any time practicing on the platform because we do millions of visits a year. And we actually, as we continue to grow our demand, we have a huge wait list of doctors that want to get onto Maple.
Really?
Yeah, because doctors talk to doctors, peers talk to peers. And doctors love Maple so much because they can genuinely help. There's great flexibility. The pay is above average and above our competitive set, and it's super efficient. So as we think about how AI can help, as we think about all of the administrative burden that we take off the doctors in the back end, doctors spend, depending on who you talk to, between 20 and 40% of their day on administrative stuff.
Yes.
You take all of that away.
Yeah.
They simply log in once they're approved to be on our platform, and we have very, very, very strict filters for who gets to be a doctor on our program. All Canadian registered, all Canadian individuals. They simply log on like an Uber driver would and say, "I've got time to do a drive. I've got time to do a drive. I got time to do a visit. I'll do a visit." All of the paperwork, all the admin in the background, all handled by Maple. So
And it's subscription based.
It's subscription based in one part of our business. So we have sort of three ways that we engage in Canada. The first is for those that want it personally and have the means to afford it. There's a monthly subscription, and for that you get you and your whole family 24/7 monthly. So unlimited visits any time of the day. Could be you, could be your kids, could be your kids 3 times in a row. Anybody in the family.
That's amazing.
It's incredible what they've built.
incredible.
And I just get to tell the story of it. I have the best job in the world.
I want to go back to marketing and leadership and some of the amazing campaigns that you've worked on. Any inflection points, learnings? Let's maybe touch on like the SickKids because everybody gets the feels when they watch those campaigns.
It's thanks for bringing it up. Yeah, one that I'm very proud to have been a part of. I think it's really important for me to say out loud that coming up with the notion of SickKids versus not me. There's a bunch of really incredible, creative, and strategic people across the city. Some still at Cassette, some elsewhere now that actually came up with the work. But at Cassette we had sort of an exec sponsor approach where one of either me or my senior team would be like the single point of contact for each of our key pieces of business. And that was my role on SickKids. So yeah, I mean, there's so much to say about SickKids. The most important thing to say is that really all that we did as an agency was sort of contain and express what an incredible organization that is. I continue to think that that's one of the best organizations, period. Take out of the conversation the fact that they were just yet again announced as the best children's hospital in the world. 100%. They're one of the most high-performing organizations in any category of any stripe that I've ever witnessed, tip to tail. And, I'm still connected to, former CEOs. They've got that traditional hospital structure where there's a CEO of the hospital and CEO of the sort of the campaign and the foundation. And from them all the way down to junior folks, getting the ads out the door, getting the donor materials out the door every single day. Incredible organization. So to me, I always like talking about SickKids because it's such an example of great communications, great brand thinking, great advertising often isn't about inventing something new. It's about distilling the truth and expressing it in as powerful a way as you possibly can. So I remember when the team showed the notion of verses and we had to go see the donors, the doctors, the kids, the parents of the kids, obviously the marketers, obviously the rest of the sort of operational staff. But when the team showed the doctors the notion of verses, one of the doctors in the back stood up and said, I want to emblazon verses on my scrubs. And it was at that moment that we knew that we had the right idea because the second that a brand and the people that make up a brand feel seen by the work and feel represented by the work, you've got the right thing. So yeah, it was honestly an honor of a lifetime to work on that.
You see a lot of brands that put you would think maybe put the doctors at the forefront of the campaign where you really put like the children, the fighters, kids, and I think that's what made it so powerful.
Well, they're the heroes.
They're the heroes.
Everything that SickKids does is in service of the kids. And to champion them and their battle was the right thing to do. There's so many norms and tropes in sort of not-for-profit and fundraising. There's sort of an unduly negative phrase, which is flies on eyes. And that idea of like we all grew up seeing all the UNICEF stuff.
Yes.
And UNICEF, by the way, what an organization. They're actually one of the groups that we went and told the story of SickKids versus to. But we've sort of been desensitized to all the ways that, not-for-profits and charities have typically communicated. And the challenge is none of those organizations aren't deserving of support. They just become sort of background noise when we're just so used to seeing the same thing over and over. And so Lori Davison, somebody I'll shout out, who was the chief marketing officer of SickKids and I've actually recently brought onto the board of the Bentway because she's such a genius. She had a great analogy for it, which is that we had to jolt potential donors off the sidelines. So the story with SickKids, and then we can move on, but the story with SickKids was that the donations were going down over time. And we were getting more, we were actually getting less of the same people, which was older female writing checks. That's where the donations were coming from. And as they were staring down the need to build this new hospital, at first they gave us a goal of $1.2 billion to be raised. That number kept creeping up over the years, by the way.
Sure.
I think we ended up at 1.4, and we actually ended up raising 1.7 or 8 by the time the campaign had sort of reached its 5-year pinnacle. We knew that we needed younger donors, more male donors, more digital donors, and we needed an idea that could not just go out as a television campaign, but be an organizing idea for the entire organization to jolt new donors off the sideline. That was Lori's brief to us, and that's what we got to.
Amazing. You mentioned, sorry, just to go back to Maple for a moment. You mentioned one of your colleagues and that she's great with culture. Culture is often the secret sauce behind scaling. So how do you foster that at Maple? A culture of creativity, agility, impact within the company, and especially as it's growing?
It's a great question. And it's so important because I've seen so many organizations build something beautiful, get some energy around it, get to a reasonable scale, get to a big scale like where we are, and lose it. Right? There's there's some famous studies on this. Famously, in The Tipping Point, there was that anthropologist that noticed that at 150 people, that culture broke down.
Yeah.
Actually, in one of my previous roles at Taxi, I was the GM of Taxi 2 in Toronto. The reason I was the GM of Taxi 2 is because the founders of Taxi believed that culture broke down at 150. And they made a statement well before this was an issue for them to handle, that if at any point in any of our markets we get to a scale where there's client demand that we can't service with 150 people, we're going to close that taxi and open a new one. And so I led Taxi 2 thanks to that ethos. So yeah, culture and preserving it is critical. What I would say is that these are the 3 founders are not the kinds of founders that are so dogged about growth that everything else falls to the wayside. In fact, I think that they understand that culture is the way to growth, and they genuinely believe that and invest in it. And so speaking of my dumb luck, I happened to join week 1 when we went down to New York and did a multi-day offsite to rewrite our values and restate and recommit to how we think about what makes. I always think values are 2 things. They're either an example, or maybe it's both of these things. They're either an example of what you are when you're at your best, or there's that old phrase, which I think is true, which is that culture is defined by the worst behavior that you tolerate.
Yeah.
And so there's the sort of aspirational version of that, and the negative one to be avoided. And I will tell you that the senior Maple team really sees culture as a catalyst for growth and not sort of a cost center for parties and beer pong and all that.
It's interesting with hybrid workers, right? So we talk about culture, but with, the two-sided marketplace and then your specialist doctors who are essentially working virtually for the most part.
Right.
Do you find
entirely virtually?
Yeah. There must be challenges with that. Is there anything you guys think about as a leadership team to ensure, satisfaction on the customer side, but also on the doctor or specialist hybrid worker side?
Let me make it even more complicated. We actually have a ton of our senior team and team generally not on site ever.
Right.
So we've got the doctor part of our value proposition to be thinking about. We have 4 Ps. We talk about our patients, our providers, our people, and our partners. And so for our providers, they're entirely virtual by definition. So how do we keep them engaged? And we'll come to that. We also have our chief product officer, Mark, lives in the valleys down in San Francisco. Because the belief was, let's go get the right person for the job, regardless of where they live, and then design the culture to not only withstand that, but maybe even benefit from that. And so, I think, like all organizations right now, we're thinking about what is our go forward in-office strategy. we know that the banks are asking essentially everybody back essentially 5 days a week come the new year. Get ready for the Toronto traffic on that. Hey, by the way, 300,000 new people in downtown Toronto. I don't think Yonge Street can handle it, but we'll see how we do. I think, to me, the best answer is coming back to your values. It has to be about values as a behavior code. And, when we think about some of our values, we actually wrote one that was just so basic. And actually, when I wrote it, I needed to sort of convince some of the team that its basicness is its power and it's not too simplistic. And the line is, we are a team. And what we didn't do is modify it. We are this team. We are a passionate team. We are an enthusiastic team. We're a collaborative. We're a team. Let's remember we're a team.
Yeah.
And something like that should be as powerful with you and I in the room and Nat on a screen as it is all three of us as a screen, as it is all three of us together having a meeting. And so you have to have a set of values and a behavior code and an expectation of excellence that is clear enough for everybody to understand it and see themselves in it, but flexible enough that they can apply it to whatever their situation is and wherever they are in the world and however they're the one person on the screen. We have a bunch of quite senior leaders that are out west, and I think of Saf and I think of Brent often, and they're so amazing at doing whatever they need to do on their side to really engage in the screen and really engage in the sessions. But we too are often thinking about them, and if there's a drink after work, we're sending them a bottle, or if there's like a fun little cupcake thing, they're getting a voucher for something on their side. Yeah. So we're always considerate of it, and we're always designing for it. Now, is it as easy as it once was, where everybody was in the darn office 5 days a week? No chance. At the same time, I think in business we've learned that people working remotely is not a sign of a lack of commitment. This is a much more multi-layered issue that I think post-pandemic, all of us in the business world are grappling with. One of the things that I think about a lot in terms of return to work commitments is a lot of the time this actually comes down to housing affordability. Because, let's be honest, the property values, and you two here would know it better than anybody, went crazy during the pandemic, right? Yeah. And that was a moment for people to either cash out or decide that they couldn't possibly live in a downtown core and went and found something more affordable an hour, 2 hours away. And now for us to sort of forget that and simply mandate people back in like it's the olden days just isn't appropriate anymore. So, to me, the best modern businesses will design for resiliency, flexibility, empathy, to understand the context in which we're operating and not simply try to replicate the sort of norms of the past.
Maple brings together technology, healthcare, service, all under one brand. How do you navigate the intersection of those worlds through marketing specifically? And, what are you drawing from your previous agency experience?
Such a good question, because what I see a lot, particularly in digital and technology brands and AI brands now, we have so much AI at work in behind the scenes in Maple.
Yeah,
perhaps rightly, but I think wrongly. Senior leadership teams at digital and technology brands often are so obsessed with what they've built that they make it about the feature. So they say faster, they say AI, they say technology, they say app, they say digital.
Yeah.
They say algorithm, they say data set. And the truth is, for all of us that are actually going to go and use any of these things, we literally don't care how you get me there. I care about the benefits. I care about speed, effectiveness, anytime. Help me with my sty at 3 a.m. before I have my big meeting the next day. So I do a lot of sort of coaching and counseling of various startups of different sizes in Canada. And one thing that I always tell people is focus on the benefit, not the feature. And it's amazing because guess what? It's really hard to build an incredible two-sided marketplace that connects doctors and patients. So of course, it would be very easy for us to be proud of the technology that we've built and the way that we patch those systems together and the way that we think that we're ahead of anybody else on the AI front. But the truth is, at the end of the day, for a mom or a dad at 3 o'clock in the morning,
matter.
They're not
matter.
thinking about that. Yeah.
Just like,
Yeah.
I don't think, I think the team at Wealthsimple, who's doing such a great job, could be obsessed with the way that they've disrupted and the way that they've used technology and caught up with the modern consumer behavior to bridge their needs in financial services. At the end of the day, they're just a great product that's a delight to use that, delivers great benefits.
Yeah.
And so, I would call them out as a great peer brand in terms of really being super disruptive, spotting a need in Canada and unlocking a really elegant solution. I think about, I know you had Hannah on from Greenhouse and that team there. I'm such a massive fan. I've been to their factory. It's extraordinary to see literally dump trucks of incredible organic produce come in through the back door, and then they leave in those beautifully branded bottles.
Yeah.
But most consumers don't need to see that. They just need to know that they're having a delicious drink that's
tastes
incredible
delicious.
for them
Yeah.
and better for the planet. So one thing I would say, and it's been a huge part of my career in terms of how I counseled clients in the past, is focus on the benefit, not the feature. So that would be one. The other way that you do that is you focus entirely on your user. Have like customer obsession is an addiction that I'm okay with. And in our case, as I said, we have our 4 Ps. We've got our people, our Maplers, who are so key. We have our partners, these 7,000 corporate clients that have bet on Maple to be a huge part of their employee benefit program. So we're thinking about them all the time. We're also thinking, as I said, about our providers and how do we use AI, digital technology, et cetera, to give them the most delightful, elegant, efficient, sophisticated a platform possible. And of course, we're thinking about our patients at all times. So I think if I were to, isolate 2 learnings, I'd say benefits over features and customer obsession, whoever your customer is.
Yeah. I mean, when you talk about it like that, it seems so obvious, but I know, from experience with us talking about HomeKin a lot, it is very easy to get excited, rightfully so, and, bogged down in the technology side of it. But you're right. Ultimately, the user just wants to know, how is this going to help me?
That's right. That's right. Users, customers, stakeholders, whatever you call them, are rightly very, very self-interested.
Yeah.
And it's our job to sort of build the right solutions for them to remain self-interested.
You are such a passionate, change maker in the city. You're always collaborative and supportive of your friends and colleagues. I know you're involved as chair of the board of the Bentway, as well as on the board of G Adventures. So outside of, Maple, do you want to share some of your work?
Yeah, happy to. Yeah, two organizations I'm super passionate about. I think maybe I'll start with the Bentway. So yeah, if you don't know, the Bentway is one of the public spaces under the Gardner in downtown Toronto. It originally started as what we would now call Phase 1, which is maybe what you've seen. It's sort of Strawn and Lakeshore is kind of where it is there. And, known quite well for the skate trail in the winter. Lots of great programming through the summer, et cetera. Yeah, I joined up with the Bentway gang 7 or 8 years ago now. And I've been the board chair now. I think I'm in year 3. Yeah, I just, for me, I've always believed that it's a little bit giving back, but it's also, honestly, I take so much from it. And I think, I've always been interested in being somebody that brings various points of inspiration into any of my roles. And I find that what I've learned just around the Bentway table from my peer directors, as well as the incredible management team there, is just so applicable in other parts of my life, whether it's me being a dad, whether it's my job at Maple back in the day, back at Cassette, or indeed G Adventures that we'll come to. Because the risk I find with the pace of business these days is that if you're singularly focused on one thing, you can become quite myopic. And you can miss signals out in culture, out in business. You can miss a chance to bring a best practice from somewhere unexpected into your world here. You can miss a point of connection, a networking opportunity for a great partnership or a great new voice to extend into a new environment. So yeah, I've found that doing a little bit of something. I've always got a primary focus, and make no mistake, CMO of Maple is my job. But I do make a little bit of time, often at a personal cost, evenings, weekends, et cetera, to contribute in other ways. And I've personally found that, yes, it's given me great pride to contribute to the Bentway and the work that they're leading, both in Toronto and in a way around the world, in terms of adaptive reuse and thinking about how forgotten spaces can be beacons for community and mental health and economic progress and. But honestly, it's a bit selfish too, in that I learn a ton from it. And I would say the same thing about G Adventures. So if you haven't heard of G Adventures, it's one of the world's biggest adventure travel companies, amazingly headquartered in Toronto, founded by the incredible Bruce Poon-Tip. Look him up if you haven't. Even before I was on the board of G, I would often reference G because you guys know the super annoying term BHAG?
No.
Okay, so it's horrible but helpful. BHAG.
BHAG, all right.
Big, hairy, audacious goal. So it's a way we should talk about it for Homekin. We should talk about it for everything that you both have on the go.
Yeah.
Because what it is and by the way, we have a BHAG at Maple. What it is it's a more extreme version of your vision or mission.
Okay.
It's something that's sort of achievable, but so far out there that you kind of can't believe it, and it makes you a bit nervous. But it is a singular idea that should guide every single decision that you make every day as an organization. And so I think Bruce would let me quote their BHAG, because I think it's, one, so singular, and two, having had the great upside of having access to the organization, it literally guides what they do every day. So their BHAG, as G Adventures, is to end poverty through tourism. So singular, so simple to understand.
So huge.
So huge.
Yeah.
And here's what they do. They go to work on that every day. So Bruce directed and released an incredible documentary called The Last Tourist. They only hire local. A lot of the big cruise ship companies that come in, you feel like you're actually going in and shopping from local vendors. You're not. All the big companies have bought those stores a long time ago.
Right.
Those are corporate employees, and way fewer dollars than should be are actually going back to the local community. G Adventures hires local artisans, local chefs, local adventurers. And so that more dollars get poured into the host country as G Adventures sends its people all around the world. So that's their way of ending poverty through tourism. Is they travel to extraordinary places and they share the wealth. So, that to me, just that alone, to sort of back to the point of being selfish in my board work at times, this was a chance for me to get a front row seat to an extraordinary organization. And I happened to join right as we were coming out of the pandemic. And you can imagine what would happen to an adventure travel company during the pandemic. Their revenues were extraordinarily challenged. And the way that organization has navigated it, I think gotten stronger because of it, and probably even doubled down on their commitment in their BHAG, to use the terrible term again, has been amazing to watch. So I really believe in not just doing one thing. I believe in having one focus, one thing that gets 95% of your time. But I personally take a lot from being engaged more broadly than that. And I love finding ways to connect the dots between all the different learnings that hopefully I can bring, having been engaged more broadly.
You've partially answered this, but I'll ask it anyway. For entrepreneurs, founders listening, what are your top pieces of advice when looking to build something that goes beyond four walls?
Love that.
Not just business, but branding, community, and genuinely connecting people.
Cool. Big question. Big question. I mean, I think the thing that runs very clearly throughout any of the sort of startups and, scale-ups and now institutional businesses that we've seen in Canada and around the world that have really worked is that they're solving a real problem. And I've seen a lot of startups that, back to the point of feature versus benefit, use technology in an interesting way to solve a fake problem. Like they're inventing a problem, and it's almost like that old thing, like it's a hammer looking for a nail. It's like, but I've got this AI thing that does this thing. But does anybody actually care about solving the thing?
Right.
And so you think about, we've talked about Maple today, and obviously you need to look no further than Canada's healthcare for a problem that needs to be solved. So there's one. We talked about what the Wealthsimple gang is doing and the fact that, at some point, probably the big five needed to be disrupted in Canada for the benefit of consumers. Those are examples of taking on a big, gnarly problem that seems almost too scary to tackle. How do you start to save Canada's healthcare? How do you actually at all play in financial services in Canada with such long established legacy brands that literally are in every facet of our life? And so I'd say one is solve a real problem. Two is, so how do you go at it? I wish I could quote the gentleman who I'd heard say this, but I'd heard recently, just make something that delights 100 people. So don't, as you're beginning to build, don't try to solve the problem for 1 million people right away. Be utterly delightful to 100 people, maybe then 1,000 people, and scale that over time. Because I think that what ends up happening often in founder stories and in early entrepreneurial cycles is you have something that might delight 10 or 50 or 100 people, and then you start making concessions on it to make it more broadly applicable. And the core idea, that original mission that you'd set out for, becomes less relevant over time, right? Because you've sort of started to become less powerful to more people. And how can you find an idea and continue to work away on that idea in a way that it continues to be powerful and undeniable and a necessity for your growing audience? So I think, not diluting the spirit of your idea would be maybe number 2 for me. And the third is, it's all about the people you surround yourself with, right?
Yeah.
Like the amount of startups, and I'm sure you've heard of many of them, where it falls apart because of politics, because of people dynamics, because of misaligned expectations, because of money.
Yeah.
How do you have the tough conversations? How do you have the right decision-making filter? How do you have an early enough sense of your culture to know who are the right people to surround this beautiful little idea with so that as it scales, you can scale as a team as well. And I, again, come back to Maple and give great credit to Brett and Roxana and Stu for having really, I think, made a commitment to themselves that even if, yes, we do have to invite new perspectives in around the executive table, those 3 are as tight as can be. And they made the right choice from day one to go into this together and have stayed committed to one another. Because, I think they did the hard work through the years to make sure that they continued to be the right 3. So those would be just a couple of reflections. And again, as you said earlier, these all sound easy to say in moments like this. There's a lot of hard work behind those 3 things. But I think, those to me have proven out time and time again.
Great answer.
Yeah. Wow. That was powerful.
So given where Maple is today, where Canada's healthcare system is today, where do you see this all going in the next 3 to 5 years?
Well, Maple's role will be clear. I mean, we are just going to continue to try to play our role in strengthening Canada's healthcare system for our providers and our patients. Like that, we're not changing.
Yeah.
So we're going to expand Maple. We're going to grow Maple. We're in conversations with more health systems to embed ourselves. We're always talking to more corporate partners. And we just want to be a bigger part of what makes Canada's healthcare system work.
Right.
Not work. So that would be one.
You're staying in Canada.
We are at least.
Okay.
Yeah. There are many conversations underway to go further abroad. Because the truth is, because we don't hire out of the Canadian pool of doctors, we are ultimately just a really elegant software solution that could be exported anywhere. We could run Australia's healthcare system. We could be a part of Germany's healthcare system. We could support corporate clients in Dubai. There's no reason that it couldn't be. We just need patients with need and providers with capacity.
Yeah.
And that exists everywhere. And by the way, I should say it's extraordinarily urgent that not only we get it right in Canada, it's really important that we get it right everywhere because I'm not sure if you've seen the demographic pyramids, but they're about to flip. So right now, it feels as stressful and acute and as much of a crisis as it does right now because we have too few younger, healthy people taking care of all of our older, sick people, right? And the challenge with that is we're not refilling the bucket of the next generation of doctors quickly enough.
Yeah.
Hence your story with your pediatrician. Nobody to take over the clinic. Get ready for this massive demographic shift where suddenly there's way more old people than ever and not enough healthy young people to take care of them.
Yeah.
So we actually work with great urgency at Maple, and we're quite happy to tell our story around the world because we want to inspire other governments, other corporate partners, other patient populations to demand more, to seek more, because we think we're truly on the sort of precipice of a generational healthcare crisis.
Absolutely.
And we're
with the
seeing
boomers aging, it's a very big concern.
Get ready for it.
Yeah.
Right? And we're not talking 50 or 100 years.
No.
We're talking now to the next 20 years.
Yeah.
So we need to figure out how to use digital technology, AI, fresh thinking to meet the needs of the next generation of patients. So we will be continuing to do that as Maple, for sure. We are going to continue to provoke in Canada and work with like-minded partners who are open to fresh solutions, new kinds of thinking. As I said off the top, people that understand that, your phone is such a tremendous catalyst for new ways to engage across multiple important parts of your life, how you love, how you bank, and indeed how you get healthcare. So we're going to keep pushing there. And I think, for Canada overall, we just hope that we can also sort of provoke enough of a movement among patients who are asking for more, better, more modern, more real time, that we can continue to push the country forward in terms of how healthcare is accessed and thought about and ultimately delivered.
Amazing. Well, thank you so much for
Thank
joining
you.
us today.
This
was
was so enlightening.
interesting.
Yes.
So
Loved
glad.
it. For our listeners, where can they find Maple and you?
Yeah, I mean, the Google search, we're pretty good on the Google search. We're also, have you guys heard GEO as well? We're pretty good with the generative engine search as well. So you can throw it into ChatGPT, you can throw it into Google. But yeah, we're GetMaple.ca.
App Store.
What's that?
You're on the App Store.
Oh, we're on the App Store,
okay.
Android, iOS,
Yeah.
everything. Yeah. No, we're very, very findable. And yeah, I would encourage everybody to go check out the website, talk to friends. I think most people have a friend who's using Maple and has something extraordinary
That's
to
how
say.
I heard about it.
Of course. I mean,
That's
word of
like-
mouth is everything,
Yeah,
right?
absolutely.
We have 1.7 million 5-star reviews on Trustpilot.
Wow.
So no, it's that thing. Once you use it once, you just get it.
Yeah.
And part of my job is going to be just making sure that more people have what I call the Maple aha moment, where it's like, how have I lived without this?
Yeah.
And so that's what we're going to work on over the next little while.
Amazing.
Awesome. Thank you so much.
Thank you, Daniel.
Thank you.